TechAfrica News Podcast from Africa for Africa. In partnership with Smart Africa. Welcome to TechAfrica News Podcast. Today I have a guest I was waiting for a long time. We finally made it. Today with me is Jean Philbert Nsengimana, Chief Digital Advisor at Africa CDC. Hello.
Hello. Thanks for having me.
You're more than welcome. Sorry for the last name pronunciation, but I'm trying. Next time it's going to be better.
That's good already.
Thank you. So you had quite a fascinating career. So what brought you then to health and Africa CDC?
Well, I initially trained as a medical doctor when I joined the university in 1993. I started in the medical school, but then, as everybody knows, the history of Rwanda, 1994 genocide against the Tutsi happens. University closes, and when I returned to the university in 97, 3 years later, this thing called computer science was being introduced, and I looked at it and I felt I could pivot and look into what the future was bringing. But I'm glad that graduating in computer science and then later on starting my second job was actually in digital health, introducing the first mobile-based digital health solutions for supporting large public health programs in Rwanda, HIV/AIDS disease surveillance. It led me to this point. So a convergence of computing and health finally connecting, and it makes sense.
So it's more like a natural evolution than ending up at the Africa CDC for Chief Digital Advisor with your background. You started once with health, now with more digital focus.
Yeah, absolutely. And my third job, in fact, from the digital health in the private sector, I was the first country director for a US-based company called Voxiva. But immediately after that, I was called on to serve in the public service. I joined as Minister for ICT and Youth for a couple of years in the government of Rwanda. And during that service, I worked with colleagues across different sectors, including with Minister of Health in introducing some of the reforms and the innovations that have contributed to putting Rwanda on the map of innovation, especially digital health leadership, where you see a very strong collaboration between the digital sector and the health sector to move towards better health outcomes, but increasingly today making the health sector an economic sector through technology.
Very interesting.
Yeah.
From your perspective, what is the biggest untapped opportunity if we look at Africa and health tech?
I would say it is the contribution of our innovators because we have no short supply of talent, of innovations, and the challenges that we are facing have also given birth to a lot of creativity and resourcefulness, and especially from the young people who are graduating from universities and confronting a bit of unemployment and wondering what they should do, and looking at the problems that their parents and communities are facing as far as health is concerned, and then sort of thinking about what they can do to solve the problem. So you've seen amazing innovations coming in response. Yeah. But the ability to harness those innovations, to grow those innovations, to be able to produce large-scale health tech companies on the continent. And my favorite is if we could produce a zebra unicorn, that would be a sign that we're getting there, because that means that there is a health tech innovation that is serving a billion people market, and that is creating jobs while advancing health security objectives.
So why is such an untapped opportunity? Is it because we're not educating the people, not making it attractive for them to come up with such an innovation?
I would say there are in every market there are supply side issues and demand side issues. There are 4 main factors that are always present. First is infrastructure. You realize that there are still connectivity gaps. There are computer and capacity, storage, compute, especially during this AI time. But the fact that more than 50% of our health facilities on the continent are not yet connected to power or to internet shows that there is the infrastructure gap. But also those gaps are there on the demand side, the consumer side. Not everybody is using a smartphone, for example. The percentage remains around 30% on average on the continent, and that's not really enough. So that's a big barrier. Secondly, we've got skills gaps, and that's true from the providers of care, but also the recipients of care. And I would say even at the policy and innovation level, we cannot say we are yet there. We still have a bit of catch up to do with the likes of Silicon Valley and other places. So that is also there, a talent gap, which many organizations, African organizations, have taken as a challenge to bridge. I think about, for example, organizations like ALX or African Leadership University, Andela. Many people have seen those organizations tapping into the skills shortage as an opportunity. The third and most spoken here, we are in Barcelona, Mobile World Congress. And when you go into the ministerial program, everybody is talking about regulations and policies, and the fact that the market is still fragmented on the continent. So
that's something would be here for the last 10 years, right?
Yes, but we are making progress. And I think we are not really good at telling the story of how much progress has been made. Because there are organizations that have come to fill that gap. You've seen Smart Africa coming very strongly to say, let's have a single digital market on the continent with very concrete examples of projects. Let's have now Smart Africa is working with Africa CDC to create a single digital health market so that you could be moving with your health data, getting continuity of care where you go, but also ensuring that the safeguards in terms of security and privacy are maintained as we do so. So policy regulation is another barrier, and I would say finance as well. Investments. Health tech has investments has grown comparatively faster than other sectors, and especially there is a promise now where you see that health tech is going to take over from fintech, which is getting a little bit saturated. So the challenge is, how do we really position health tech as the next frontier when it comes to tech investments on the continent?
I mean, it's probably because there's not an immediate revenue stream.
That is true, but also I think the problem is if you look in the very short term, the health sector is a social sector. It's like education. You can't say, let me educate this kid and start milking the education next week. You have to really consistently invest. So the social sectors, they do have return, but they also need a little bit patient capital. So if you're a CEO and you are looking at beating the next quarter's target in terms of growth, health tech may not be your ally. But we saw how fintech grew as well. It was not immediately clear that the telecom sector was going to benefit from it. In fact, telecom behaved in a way that voice was everything. Then data came. There was a bit of slow movement towards adopting and democratizing access to data. It's happening now. Fintech also went through the same adoption curve. So I think we're still slow at the beginning when it comes to health tech, but at some point it's going to pick up. And those who will be ready at the time when the pickup happens will benefit the most. So I would say this is the time to invest, and invest patiently, not just say if the return on investment doesn't come within 3 months cycle, that I don't invest. I think those are the kind of thinking that will make the disruptors come and disrupt the sector.
So where would you start? I mean, if you look at the continent, we have a quite diverse landscape in terms of health insurance and public health. It's very different from country to country. But if you look at health tech and the opportunities, and that's what I mean is, on one side you have the private sector who probably has an interest in terms of revenue streams to come up with solutions which have their justification. But is it at the beginning that the public or the government, the public sector must be clear what he wants to achieve within the country to, let's say, deliver a more improved, more modernized public health?
Well, there are many entry points. We've seen, for example, telemedicine.
Yeah.
Africa is moving towards the universal health coverage objective by 2030. But if we look at the speed at which we've been moving, I don't think we're going to reach there if we continue to move at the same speed. So we need to accelerate that speed. Yeah. And the only way to accelerate the speed and make sure that by 2030, everybody on the continent, regardless of where they are or their income levels, have basic access or access to basic services. If you feel something, you at least have a phone number you can call and that you can get that advice. And if you need to go to the nearest hospital or health center, you get that expert advice, and you don't spend your time going when it was not necessary to go, when you could get support and help from your nearest community health worker. So just investing seriously into telemedicine would be a starting point. During COVID, for example, we saw a bit of an uptick, a growth to that. But what people don't realize is telemedicine grew by 40-folds, 4,000% in the rest, in the advanced economy. And in Africa, it was only 300%. Still good growth, but nowhere near where the rest of the world has gone in embracing telemedicine. And with the growth of telemedicine, what also comes is an explosion in terms of health data collection that is available to the practitioners and the policymakers to make better health policy decisions. So that could be a starting point. But health is not only treatment. In fact, a lot of health happens outside the healthcare centers. It's at home. It's about prevention. So there is a lot that can be done. And Africa, with the young population who are digitally native, they have a lot of opportunities to use their smart devices as a tool to get educated on better health behaviors and avoid health problems and diseases in the first place using technology. And I think, once again, a big partnership with the people who understands how consumer markets work and the telecom really understand that. I think a partnership with those and the public health can really produce very tangible benefits in the short run. And you don't need to go far. I think the innovations that prove those cases are already there. There are organizations like the Africa Health Tech Hub in Kigali. If you go there, at any given moment, you will find 40 high potential startups that are being incubated there, and just pick one or two, invest in them, and you see how they are going to change the landscape.
So the potential is there.
Undeniably.
That's good. That's good. When we look at the digital transformation process in Africa, so how is Africa CDC leveraging from technology to improve healthcare outcomes across the continent?
Well, we've talked about what we see as the main challenges. I think the first one is the infrastructure gap. So Africa CDC is really working on this under the guidance and leadership of the Director General himself, Dr. Jean Philbert. He's given very clear directives in terms of how to partner with the key industries like satellite industry, like MNO industry. That's why I'm here. And his vision is really to make sure that every African from birth to up to the last day, their health is digitized. You have birth registration at birth. And then you receive your immunizations, and then your growth is monitored, and nutrition.
So you have a track record.
A track record, a horizontal health record for life. And then that connects to your education when you start primary school and secondary school until the time where you graduate, become a taxpayer. All these records are connected, and then you start contributing to Social Security. You take social health insurance, and then continue your journey. And his vision is even, beyond just the health, how the health can be the catalyze even the digital transformation of other sectors. around something that is more person and citizen centric, as opposed to being centered around the organizations that provide services, but around the person, the individual, the citizen, on behalf of whom we are all working.
So we're currently in times where we see that AI is accelerating very, very fast. So we see that technology integrations are happening faster than before. If you look back 4 or 5 years ago when everyone talked about big data, it was a topic. It took a few years until people really understood it. But now it feels real with AI. I mean, most of the people feel it on the phone when they go to ChatGPT or the others. So what do you think, what role does AI, big data and predictive analytics play in the disease surveillance and epidemic preparedness?
Well, first of all, I think AI comes really to help us bridge that human resource gap, because on the front line, we've got the community health workers, we've got the nurses in the rural clinics, but also we have the medical the health providers in other levels of care, and disease surveillance happens at that level as well. So AI is coming with tools and capabilities, such as connecting information that would be very difficult for a human being to connect in real time. So information about the symptoms, for example, that people are coming to seek care with in different areas of the country. It is very easy, if this information is centralized, for an AI algorithm to pick some trends and be able to predict what's going to happen before it happens. I mean, I think that has been discussed so many times. Again, for me, the question is, are we doing it? Are we having some early indications through proofs of concept that are being done across the continent? I know, for example, Gates Foundation has invested quite a bit in that area of AI for primary care. There are governments who are already doing it at a limited scale. So, but as you say, it's moving faster than people realize. And that's what exponential technologies do, because they start moving very slow and people are used to seeing things going linearly, but then at some point they start growing exponentially. So I'm expecting that in a year or 2 years from now, we are going to start seeing very successful AI-powered innovations driven by either the private sector or governments that will really transform how disease surveillance is done on the continent, such that we can be able to prevent, detect, and respond much, much faster, better to disease threats than we have been able to do in the last couple of decades.
You mentioned centralized information about, let's say, a track record or disease or whatever happens in that circumstance. Would you say we need also our own health infrastructure in the countries where, say, it's not only about the, let's say, generic digital infrastructure, but it's also a specific one, let's say, tailor-made for health?
Those concepts have been there, like the Health Vault. I think Google, Amazon tried to do those kind of concepts, but I think there was a bit of a pushback from the market because of the sensitivity of health data to really aggregate that enormous amount of health data. I think the question on the back of people's mind was, what happens if somebody hacked into this huge database? And I think if it's a technology challenge, there is always a technology response. So the technology response was, okay, can we think about a federated architecture, a decentralized architecture, such that you don't have to really put all this health data in one place for you to be able to perform analytics? So those architectures have come and have evolved and matured. Today, you don't need to centralize all this data for you to be able to perform analytics on top of it and generate insights. And I think it's good from even an efficiency point of view. The most important thing is not centralization, is access. And at some point, much of this data actually sits in people's hands, because there is a lot of health data that's produced through the wearables, and increasingly that amount of data is going to be to increase. There is a lot of health data that is going to come from like personal point-of-care devices that people carry. So I have my blood pressure equipment that I use at home, and that blood pressure device is connected to the internet, and this information could be available. So there is a lot of data that is produced outside the health facilities, and by using that kind of decentralized, federated architectures, all that information could be available to be analyzed and contribute to improving the health, both individual but also public health.
We talked earlier about telemedicine, and you said Africa CDC has the goal, or wish that we can spread it out through Africa quite soon, or in the next couple of years. So what do you think would be the best way to accelerate that, which is a quite powerful tool?
Well, there could be many ways. For any innovation to grow and cross borders, I think we need to look at the regulatory landscape. I know of telemedicine innovations that have hard time, have had a hard time starting and penetrating and growing in the market because of trust issues. What kind of care are you allowed to dispense using telemedicine? Which diseases are you able to treat? How can you treat when you have no access to lab, when you cannot order lab or make a prescription so that somebody can go pick a medication? But those kind of concerns are getting removed. I think what organizations such as Africa CDC could do is to take those good emerging practices and highlight them to sort of de-risk that space. And we've started doing that. So if you go to our website, for example, last year in October during the Africa Health Tech Summit, the Director General launched something we call the Africa CDC Health Tech Marketplace. So in that marketplace, you will find health tech innovations that have been vetted by experts who looked at their potential, the fact that they are solving a real public health challenge, but also how they are solving the challenge, whether it is technology is robust, is scalable, is secure, is interoperable, because that is also very, very important. And those that have passed the test now are published on the Africa Health Tech Marketplace. And that's a process that is going to continue because there are so many more eligible that are not yet there. And the message that we are sending to our member states and the countries is, look, don't hesitate to approach and work with all these innovations. In fact, one of the things that we assess is in their home markets where they started, whether the governments are comfortable. They can attest that this innovation has helped them solve a big challenge. So we encourage other countries to adopt. But we are going to go beyond just encouraging by publishing their list to really build a marketplace where it becomes even easy to procure as a country those innovations. And it becomes also easy to sort of invest in them. We're going to be engaging the investor community so that they can also come and help grow by investing and making money, but also advancing the impact that those innovations are doing. So the regulatory and the policy landscape is something we're doing something about, the promotion of innovations, but also we are thinking about building even a sandbox, because at some point, we won't have enough human beings to do the vetting process. It needs to be automated at some point. If somebody claims that their innovation use AI to solve a problem, you really want to know that it is AI, what kind of data these algorithms are being trained on, because AI can also perpetuate some of the inequalities that we've seen with human beings. So putting in place sandbox environments that allows to self-test the innovations. So those are some of the initiatives that Africa CDC is doing to really accelerate the pace at which those innovations can be successful.
So when we look at telemedicine, and you raised some valid points which made me think, because it's not that easy for every country, because you really must somehow decide how can I verify what they really can, let's say, what statements they can make, what disease they can really find? And this is it not something where we should be able to create a kind of a blueprint where we have one market where it worked very well? We know it from a regulatory perspective. Those are the things which are important for privacy, security, and also to make sure that it will not be abused, obviously.
Yeah. And the good thing is, whatever innovation you can take, you will find some country that has already tested it and has good lessons in terms of what to do, what to avoid. So telemedicine, for example, there is a whole community of practice around telemedicine that is building to exchange those practices and be able to scale them across the borders much more strongly, but also scale them even domestically where they have been tested. Very few actually have been able to scale even in their market of origin. So scaling is a challenge that we are confronting today. And it could be telemedicine, could be AI-based tools, could be medical equipment. There are a lot of innovations that are coming in that medtech space. Some of them made in Africa. So that's also another important point to make. Africa cannot continue just to be a net consumer of technologies at some point, and it's happening. We just again need to accelerate that to encourage the made in Africa technologies in collaboration with the rest of the world, by really owning the intellectual property on the continent and be able to compete on the global stage.
So what can we do to, let's say, support the health startups in Africa?
Again, remove those barriers to scale, solve the infrastructure gaps, and that is possible. Today, we're talking about satellite, for example. There were times where it was a huge challenge to say, how do you connect people who live deep in rural areas? How do you get power to them and electricity? But Africa is very blessed with solar potential. So solar can be deployed very quickly. Internet connection can be deployed very quickly using technologies like satellite, but also mobile networks are increasing and their footprint. So I think for the longest we've talked about access to broadband as the biggest issue. I think today we are within the reach, the grasp of solving that problem. So can we tick that box? I think that can be solved. The next problem is talent. Do you have enough talent? And the answer is yes. I think even the talent that we have is underutilized. So how can we most effectively harness the talents? Do we have the investments?
Or how can we make sure that the talents stay in the country and not leaving?
Yeah, true. There is sort of a brain drain. The talent goes where it is mostly welcomed and mostly needed. We need to create opportunities right here back at home. The way that our talent is compensated, is encouraged, their innovations are valued. All of that will contribute to retaining the talent at home. But I'm not really opposed to seeing some people go abroad because they go, they learn, they come back. And even while they're there, we know they send a lot of money in forms of remittances, and we've passed the point where the remittances coming into the continent are higher in volume than international development aid combined. So that's good news. But it's and also Africa is really doing well now, attracting talent from the rest of the world as well. So it's a symbiosis that is happening. I'm not underplaying the problem of talent or brain drain, but there is also brain gain that we need to recognize that is there. So I think the free flow of talent, of labor, is part of what makes capitalism a better system. So let's it continue, but let's do what we need to do to attract the best talent, both domestic and international, on the continent.
So we can say we look actually at two pillars. On one side, we must build the infrastructural foundation through connectivity and, of course, through services and through maintenance. And on the other side, we have to upskill our younger generation or the people who come after us in order to, let's say, make it successful.
Yeah, both those fronts are very necessary. And traditionally, you've seen the infrastructure and upskilling being left to governments mainly to solve. So the question today is governments and the international development sector. But there are serious questions today about the limits of those sectors when they work alone. So the question is now, how do you get more and more private sector contributions and investments in those social sector so that they can benefit also from those investments, both domestic and global. And we've seen that. The health sector, for example, there is a lot of clinics, the hospitals that are built by the private sector. So the fact that health as a business is a very promising business. In fact, there is one of my good friends, Dr. Amit Takar, leads the Africa Health Business and conducts this annual symposium. And the message that consistently delivered during those gatherings is the private sector has a big role to play in advancing health and healthcare delivery on the continent. Same with education. It doesn't have to be only the government thinking about education. And it's not also about the private sector investing to serve the needs of the well-to-do, the haves and leave people behind. They are very good, inclusive, but also still privately driven models for delivering public service or social services that are emerging on the continent that needs to just be identified and supported.
So what is your outlook for the market for the next 5 years? Or let me phrase it differently. If you could have a wish list of 3 things you immediately could change to make an impact, what would be the 3 things?
I would break the borders, just to make the 1.4 billion people market available to all the innovators across the continent. That's number 1. Number 2, I will multiply by 10 the amount of investments that is coming in the health tech sector on the continent. Number 3, I would invest into Africa-based infrastructure such as data centers, so that we build our data sovereignty on the continent as a continent, looking at sovereignty not country by country, because those markets are too small, but as a continent. Until there is a global framework, I think it's important that markets, I see what's happening in Europe. Europe is really struggling and working hard to consolidate so that their innovation sector can compete with the Indian sector, the Chinese and the Americans. Africa should not stay behind on that curve. So if we do the 3 things simultaneously, I think within the next 5 years, we are going to see the first couple of health tech unicorns on the continent, which it is a symptom. It's not the end goal. It's not like you want 1 or 2 guys to start, making billions. But when they make $1 billion, it's a sign that the innovation has hit what is known as product market fit. It means that the consumers have recognized the power and the potential and the impact of that innovation. So the financial success is a metric that even the impact is happening. You can go and measure the impact. But for me, just looking at the financial performance, it will tell me that something good and fundamentally transformational is happening on the ground, because we're talking about a social sector that engages people, most of whom live under $1 or $2 a day, but somehow that innovation has been able to touch their lives such that they are all adopting it to the point of creating a unicorn. And the other thing is, to reach that status, that size of a company, you are employing massive number of people across different countries. So it means that you're creating jobs and you are contributing to the economy and you are paying tax on the continent. While all these other unicorn, big tech in Africa haven't really figured yet out how to make them contribute in terms of tax. Some countries are trying, but again, doing it separately has not worked for us. But those kind of homegrown innovations will be contributing directly through jobs and taxes to the growth of the economy. So I think it's something that we can put our mind together and do, especially that we have a precedent. We've seen how the fintech sector did it over the last 10 years, and that can be almost replicated for the health tech sector and get there as well.
But the fintech sector was also very hardly private sector driven.
Yeah, they were private sector driven, but also there is a lot of contribution that perhaps many people don't recognize that came from the international development. A lot of evidence was generated by big organizations like the World Bank, the UN system. They invested in evidence generation to increase investments into the fintech sector. Some of the innovations actually initially benefited from the development dollars. So that is also to be recognized. But yes, I think it's a fantastic success story. Some of the best innovations that came from Africa and went to the rest of the world. I think health tech also holds that potential. It just needs to be unlocked.
So the private and public sector, they must work hand in hand to, let's say, accelerate health tech in Africa.
Yes, and they are working together. They're working hand in hand. If you go in any country of your choice and you look at how the public sector is working with the private sector, for example, in the telecom and the tech sectors, the collaboration is there. But it's not yet where it should be. And I think that's what we need to recognize. One of my mentors, the late Professor Callistus Juma, wrote a good book called Innovation and Its Enemies. And he sort of provides a caricature in that book about how different cultures, different regions of the world approach innovation. And he says products are safe until proven risky in the US. So there is a propensity to let innovation go ahead of regulation. And then he said products in France or Europe, generally products are unsafe until proven, are risky until proven safe, which means you have to regulate. So by default, people say, no, has this been allowed? So products are risky until proven safe. And then he said, in Africa, products are risky even if they don't exist. So I think that's meant to say that
that frames it very nice.
There is a lot of it's almost like a virgin ground that needs to be explored. There is a lot of innovation that had not yet reached. I mean, he passed away in 2016. This whole AI thing was not yet a phenomenon. But I think the wisdom there is as a civilization, how do we approach innovation? Do we embrace innovation, or do we push back against something that we fundamentally don't understand? And I think the attitude towards something you don't know, whether your first reaction is to say no or first reaction is to say yes, matters a lot. And I think Africa has the opportunity to learn from those two, because as much as you want to open up to the innovation and the unknown, you also need to make sure that basic protections are in place.
Especially in the health area, health tech area, because it's something very sensitive. You have immediate effect of whatever product, if it's safe or unsafe, it doesn't matter, because you're immediately affected by it.
Exactly. The costs of that risk sometimes human life, so you have to be careful. But what you also need to realize is, by not allowing innovation to come and solve those problems first, we still lose lives in form of those who are underserved. So if somebody brings an innovation that is going to serve the underserved, I won't push back too much just because I'm protecting those lives, because they are being lost anyway. So how can we get sort of a sense of urgency of really scouting those innovations that have the highest potential to save lives and save money, or help make money, and then get them to be accelerated. And we know that not every innovation is going to be successful. That's another thing. So do we discourage failure, or do we celebrate or encourage failure so that people can fail and come out and come back up again and try something new? I think Africa should be more on that side of being open and embracing innovation.
And have a leap of faith.
And then do together. And this is what perhaps has been also missing. And I was following a very interesting talk by a gentleman from Smart Africa this morning, which is, don't leave the regulators or the government as bystanders. Bring them along. And governments are open. In fact, I have had more challenges from government to the private sector and to the development sector especially, lamenting and complaining about those sectors being too slow. Governments want to move now faster than those sectors that are able to move. So how can we combine that kind of willingness to collaborate and to co-create those kind of innovations, and then bring the regulators on board so that that's what things like Sandbox do, is you don't wait, for somebody to submit something and you to examine whether it is compliant or not. No, you develop together, you learn together, and then you grow together.
Yeah. Very insightful. Thank you very much. Thanks for your time. I really enjoyed it, and let's hold on hope that when we meet in a few months again, the situation will have changed as quick as AI changed already the industry.
Yeah, absolutely. It's hard for human beings to change in exponential fashion, but we're going to try and challenge ourselves and change our ways of thinking and working to match the potential of technology so that we don't stifle.
Especially in such a complex topic. It's not like developing a product or a phone. It has a deeper impact. So it's very... Yeah. Thank you very much.
All right.
Pleasure.
Thank you.
That was TechAfrica News.